Record, my name is Brian Worrell, District 4 City Councilor, and I am the Chair of the Boston City Council Committee on Small Business and Professional Licensure. Today is November 8th, 2024. In accordance with Chapter 2 of the Acts of 2023, modifying certain requirements of the Open Meeting Law and relieving public bodies of certain requirements, including the requirement that public bodies conduct this meeting in a public place that is open and physically accessible to the public, the City Council will be conducting this hearing virtually via Zoom. This hearing is being recorded. It is also being live streamed at boston.gov/city-council-tv and broadcast on Xfinity Channel 8, RCN Channel 82, and Fios Channel 964. Written comments may be sent to the committee email at ccc.smallbiz@boston.gov and will be made a part of the record and available to all councilors. Public testimony will be taken at the end of this hearing. Individuals will be called on in the order in which they signed up and will have 2 minutes to testify. If you wish to sign up for public testimony and have not done so, please email our Central Staff Liaison, Shane Pack, at Shane, SHAN as in Nancy, E.Pack, PAC, at boston.gov for the Zoom link, and your name will be added to the list. Today's hearing is on docket number 0183. Order for a hearing to facilitate a community process to support consumers in District 7 impacting the impending closure of Walgreens at 416 Warren Street. The matter is sponsored by Councilor Tanya Fernandez Anderson, Councilor Brian Worrell, and Council President Ruchi Louis Jen, and referred to the committee on January 24, 2024. I'd like to acknowledge the seriousness of this issue and how it especially threatens not only my district, but several neighborhoods in the city of Boston. Areas which are largely low income, Black and brown, and historically marginalized communities. Since 2022, 4 of the 18 Walgreens locations have closed in Boston, and they've all been in Roxbury, Mattapan, and Hyde Park. They've done so by stating they have suffered profit losses in these areas and that these closures are necessary to keep business open. On October 15th of this year, Walgreens executives stated their plans to close 500 more locations by the end of the current fiscal year and about 1,200 within the next 3 years, prioritizing so-called poor performing stores. But what does poor performing really mean? When Walgreens executives themselves reported in the same month that they are exceeding fiscal 2024 targets for $1 billion in cost savings, and that fiscal 2024 sales increased 6.2% to $147.7 billion. And what does poor performing mean when the communities threatened by a pharmacy closure depend on your business for medical resources, healthcare, groceries, and much more? This concern goes beyond Walgreens. CVS plans to close about 300 more stores, including in Massachusetts, by the end of this year, attempted to justify pharmaceutical closures by suggesting supposed changes in population, consumer buying patterns, and future health needs. Does not work well when current and future health needs suggest our underserved communities will only face increasing barriers to medical and healthcare services. These disparities include higher rates of chronic conditions such as heart disease, diabetes, and more. We must come to a consensus on how to best ensure all of our neighborhoods in Boston have access to the care they need to live long and healthy lives and to increase overall metrics of well-being. Accessible pharmacies are crucial to this. I'd like to turn it over to my council colleagues, starting with the original co-sponsor, Councilor Fernandez Anderson. The floor is yours.
Thank you. Good morning, everyone. Thank you, Mr. Chair, and thank you for working with our office to hold this hearing. This hearing, as you mentioned, has been a long time coming, addressing issues that is crucial for Roxbury, but not just Roxbury, but other communities of color here in Boston. Earlier this year, our office received word that Walgreens just to put it in context of where we are, at 1416 Warren Street in Roxbury would close. We got to work and file this hearing along with my co-sponsors, Councilor Rel, Councilor Jen, and immediately got to work on talking about the issue. Met with Chief Idowu as well as Dr. Jakutu. The community then held several protests where we were all present and spoke on the severity of this topic. I am grateful to have representatives from both administration and Walgreens present here today on a Friday at the end of the week after a very hard week. This is not a hearing meant to antagonize or put anyone in the hot seat. No one here is individually responsible for closure of any other Walgreens on Warren Street or any other ones, but we also cannot allow the growing trend of pharmacy deserts to continue to impact our communities like the one in District 7. I hope that we can have a productive discussion and hopefully solution-oriented or proactive conversations about how we can find solutions for the future. Thank you.
Thank you. We'll now go to the other original co-sponsor, Council President Ruthie Louis-Jett.
Thank you, Mr. Chair, and good morning, everyone. I want to thank my district council colleagues, Councilor Fernandez Anderson and Councilor Morrell, for their advocacy for their neighborhoods. It's obviously an issue that's disproportionately affecting our Black and Brown communities. As someone who grew up in Mattapan and Hyde Park and who lives in Hyde Park, our Walgreens here in Hyde Park was affected. What we've learned and what we know is that the profit model does not care about people. It does not care about regular people who need to access their drugs, who need to make sure and their medication, and considering how close that is or isn't to their home. And so we have to build alternative models. You know, I want to lift up, as an at-large city councilor, I get to see what's happening across the city. And, you know, in Charlestown, you know, I think it was a month after we got word of all of these closings of Walgreens. We were opening a new pharmacy, and I was there and very happy at the ribbon cutting in Charlestown of the new health pharmacy. They also have one in the North End. Thinking about what it looks like to support different models for ownership in partnership with either community health centers or small mom and pop black and brown owned pharmacies or worker owned pharmacies. I think all of these are things that we should put on the table so that, as Councilor Fernandez Anderson said, our residents aren't left in pharmaceutical desert. So I again want to thank my colleagues for putting this forward in their work. This is incredibly important to me as a president of the city council and as an at-large city councilor. And I look forward to our collaborative work together to make sure that we're addressing the needs of our residents. Thank you.
Thank you. Councilor Flynn, the floor is yours.
Thank you, Mr. Chair. I'm sorry about that, that delay. I want to say thank you to the sponsors for bringing this forward. I will be brief. This is an issue of social, economic justice, racial justice issue. I'm here to learn about the issue and to support my district council colleagues that are doing the best they can under very difficult circumstances. So whatever I can do to help my city council colleagues, I'm here for that. So thank you, Mr. Chair.
Thank you. Councilor Coletta Zapata.
Thank you so much, Chair. And I want to just thank the sponsors for this incredibly important docket. You may be wondering why a councilor from East Boston, Charlestown, and the North End is on this call, but I really am here to support my colleagues, understanding that pharmacy deserts just impact already less well-resourced communities and vulnerable communities. And I'm really here to support them in this fight, understanding that when folks have to go further to get their prescriptions or any material, whether that be sanitary pads or tampons, which is something I've also been working on, it affects folks. And so I'm really here to support my colleagues and just want to thank them for their leadership. Thank you.
Thank you. Councilor Mejia?
Yeah. Good morning, everyone. And thank you to Councilor Anderson and my district colleagues for stepping up. I think this is an issue that is dear and near to me. I remember, and actually almost 2 years to the date, I'm reading an article here from November the 7th, 2022, when one of the first pharmacies were on the chopping block, if you will. Our office organized and worked alongside. We met with Boston Medical. We've met with nonprofit organizations and other folks to really figure out how do we get ahead of this conversation and how do we create space for us to think about different models. We worked with Pharmacy Lux that was based in Roxbury to figure out how we can support our residents through, collaborative models. And so I'm really excited that we're going to have the opportunity to think further about how the city can help stand in the gap and how can we be innovative in this moment in time to provide support services to our small businesses. So I'm really glad to see Chief Idowu in the Zoom here because I know that when it comes to being thoughtful and strategic, especially when we have opportunities to support small mom and pop shops, I feel like there is an opportunity and a space that we can fill. And I'm just really curious and excited about what those possibilities could look like. So here for the conversation and to be a thought partner alongside my colleagues. Thank you.
Thank you. Now we'll go to panel testimony. I'd like to now introduce the panelists today. From the City of Boston, Chief of Economic Opportunity and Inclusion, Chief Idowu. Danielle Williams, Executive Director for Prophetic Resistance, Boston, Massachusetts Communities Action Network. Reverend Culpepper, pastor for Pleasant Hill Missionary Baptist Church. Jay Trivedi, co-chair Boston Conference of Community Health Centers Committee, Massachusetts League of Community Health Centers. Walgreens Regional Vice President, Elif Gutierrez, and then Walgreens Director of Pharmacy and Retail Operations, Samil Patel. And sorry if I got any of your last names incorrect. But starting with Chief Idowu and going to Danielle Williams, if you have any remarks or opening statements.
Well, thank you, Counselor, and thank you to all who have helped to make this conversation possible. I will give the briefest remarks you've ever heard me give at these hearings, only because my goal here is to as Councilor Mejia stated, I mean, there's a lot of ideas that can be shared here that we want to take back in our office to figure out how best to be supportive here. I will. I want to especially thank Councilor Fernandes-Anderson because we did not wait until this hearing to have conversations about this topic. When, as Councilor Mejia stated, when the first article came out in November last year about the Walgreens closing in Roxbury, we were already on the phone talking about, how can the city step up and be supportive. The mayor hosted a conversation earlier this year with community health centers, hospitals, Walgreens and CVS, and representatives from small pharmacies across the Commonwealth to talk about this issue. Most of the conversation focused a lot on the business model and why we're seeing a lot of these closures happen, and then I can let folks on the panel talk a little bit more about that. But I will say that one of the things that came out of that is how to better partner with Walgreens and CVS in particular, because, like all of us on this call and those joining virtually or who will, watch this later, the city was also finding out via press release or via news article about these closures coming, and it wasn't, therefore we were not in a really great position to help all stakeholders, whether it be the corporations involved or our residents. And so what's happened since then is that we're at least given a heads up for some of the closures that will impact the city of Boston, which is important because we get to activate our Age Strong group to get calls out to engage seniors and others who may be impacted. In fact, the Urban League and Age Strong have been working together with Lyft to provide free service to those who needed support getting to and from area pharmacies that were impacted by the closures. But the other piece of it is what happens to the real estate when Walgreens and CVS leave. You know, for some of these areas that they left, the lease was already up, and so they left. We saw this in Nubian Square where Walgreens left, and what came in right after was a Foot Locker. You know, again, if we had known earlier, we could have engaged the landlord, engaged community to figure out what is it that people want to see, and brought in something that would have been beneficial to the community. Not to say Foot Locker's not, you know, love sneakers and everything, but just saying that everyone was surprised when that happened. We're going to see a little bit of a different thing happen in over on Quincy Street, and what's going to happen there. That we were able to engage the landlord when we got a heads up, and what's going to move into that space is something that the community, I think, will be really happy with, and where that the particular pharmacy service will not go away. And so, you know, we're hoping that what will come out of this conversation is a strengthening of that partnership and relationship, and not just my office getting that heads up, but impacted city councilors as well, so that we can facilitate a community process for, you know, understanding what can move into this space when the tenant is leaving, but also to spread awareness. Again, a lot of people find out when they're showing up to the pharmacy, or they might get something in the mail, but we know that people communicate in many, many different ways, and we just want to make sure that information is proliferating through the community so everyone is aware way in advance, not just a couple of weeks, so that folks can prepare and that we can step into that gap, as Councilor Mejia stated. But I appreciate this opportunity, and I look forward to the conversation.
Thank you, Chief Idowu, for being brief. Danielle Williams. Oh, Ethan, if we could promote Danielle to a panelist, but in the meantime, we'll go to Reverend Culpepper. Nope.
I don't see the Reverend in the room, Mr. Chair.
Okay. Danielle Williams, see that you've been promoted.
Hey, good morning, everyone.
Morning.
Oops. Good morning, everyone. First, want to thank Councilor Worrell and Tanya Anderson, Councilor Anderson, for this hearing. I know it took a while for you all to get it on the books, and I completely appreciate it. Just want to quickly say that I worked in city government. I was a Director of Constituent Services for the first Felix Arroyo. So I just want you all to know, when you leave city government, there's still exciting things for you to do. So first, my name is Danielle Williams. I'm the Executive Director of Prophetic Resistance Boston. We represent 12 churches. We're a group of pastors and congregation members that have moved from within the four walls of the church to actively engage our community, Black and brown communities in Boston, by listening to their stories and then taking those stories and moving them to public action. So we listened to hundreds of stories of customers of Walgreens in Roxbury. And as a result, we did some press conferences with the senators and other city officials. However, I kind of want to highlight my story. I've been going to Walgreens in Roxbury since it first opened. Last year, I was diagnosed with hypertension. So I started going there to get my medication. I can tell you, I was surprised when Walgreens was being closed. I was never told. There was no notification at all to customers. There was no signage until we started protesting that Walgreens was actually closed. I go to a Walgreens also in Brookline, and in Brookline they have a huge sign that welcomes customers from other pharmacies. However, not the same type of impact in Roxbury. And I also want to say I'm still waiting for notification from Walgreens that they've closed. Can you imagine? Still waiting. No notification. No robocall to customers saying, hey, we're closing. Nothing. So Not only are we, as Black and Brown folks in Boston communities, not only are we historically marginalized, but we're most disproportionately impacted by health issues such as diabetes, hypertension, and trauma. Kearney Hospital, as you know, closed, and we lost a major healthcare service in our community too. But there are impending pharmacy closures that will impact healthcare services for many City of Boston residents. Kearney Hospital had to give a 90-day notice to their folks that they were closing. In our community, we watched as Walgreens shelves became empty, which to many customers told us that the closures were soon coming. So Prophetic Resistance Boston, along with Mass Seniors on the Rise and other organizations and churches, we drafted a piece of legislation that Tanya Anderson has. And we walked it around to City Hall, city officials, city councilors, I believe in June. And there was great verbal support. However, we want to see this piece of legislation, which is a 90-day notification that would require all pharmacies that conduct business in Boston to give a 90-day notification to their customers. And if Kearney had to do it, then why can't these pharmacies do the same? We believe that these impending pharmacy closures, if folks are given the 90-day notification, it helps for them to be proactive so that they can go and transfer their medication to a place of their choice. Thank you for listening. And hopefully we can get this ordinance passed so that the City of Boston is proactive with the residents of Boston that have health needs.
Thank you. Jay, the floor is yours.
Good morning, everyone. Thank you, City Councilor Fernandez, Worrell, Ugine, for finally bringing this meeting to fruition. As mentioned earlier, my name is Jay Trivedi. I am the co-chair of the Mass League of Community Health Centers Boston Conference. I'm also the CEO of Upham's Community Care, mostly known as Upham's Corner Health Center, right here in the heart of Dorchester. And I think one of our biggest issues that this brings forward, besides the string of all these for-profit pharmacies closing, as already mentioned, and fortuitous for us, earlier this year, we as a community health center opened a community pharmacy open to our neighbors, our community members, outside of just those individuals who use us as a primary care site or as patients of our organization. We see about 12,000 patients within primary care, PACE, senior care options, eye, dental, and pharmacy. As a nonprofit federally qualified health center, we are mandated to provide the high quality, low cost of care, always being culturally sensitive based on the healthcare movement of community health centers over 50 years ago. And our ultimate goal is just to provide highly accessible healthcare as a right. We also expanded to providing social services and, as I mentioned, our pharmacy. I think it's important to note that as national for-profit pharmacies are closing in Dorchester and our surrounding neighborhoods, it's converting this in-house pharmacy that we had to serve the community, and we're seeing on a regular basis new individuals coming in to get our access to our pharmacy. And as noted earlier, some of these individuals who are walking in did not know their pharmacy was closed until they walked up to the doors. So right now at Upham's, we have an 800 plus patient wait list because of the historic underinvestment in primary and preventive care in our communities. And it's our job to serve them, even with their inability to pay. And that makes it challenging when we have to compete with this high cost of the current labor market. In addition to these for-profit pharmacies closing, several actions in the recent years by pharmaceutical manufacturers and PBMs, oftentimes owned by these for-profit pharmacies, has decreased access for low-cost medications to our community members, as well as to our organization. They are doing other steps that are predatory in nature, such as urgent care centers and for-profit minute clinics that ultimately drive costs up and extracts resources from the community. What can I say about these for-profits in our neighborhoods? They are looking at the dollar first, and our community members second, or even third. As the council and administration thinks about the best way to focus on resources that impact our community, I ask you to consider supporting the federally qualified health centers like us in our neighborhoods, and to help maintain access to care and allow us to continue to offer all our services, inclusive of pharmacy, so our residents don't have to live in more pharmacy deserts. Thank you for your time.
Thank you. Alif, the floor is yours.
Thank you so much, Chairman Worrell, and the rest of the City Council team and distinguished guests. Thank you so much for inviting Walgreens to this very important hearing today. My name is Alif Gutierrez. I'm a Walgreens team member. I'm also the Regional Vice President that supports the New England region. I'm incredibly proud to represent the company on behalf of our pharmacists, our pharmacy technicians, and all of our store team members. We at Walgreens share a deep commitment to offering equitable access to healthcare in the communities we serve. And we have learned a lot from hearing your perspectives and those in various communities that we serve on how we can honor this commitment moving forward. I don't just work in the Boston market. I'm a part of the community myself. I myself am a proud son of immigrants who came from Cuba to Lawrence, Massachusetts, a neighborhood in Massachusetts, one of the poorer neighborhoods in Massachusetts, back in 1973 when I was just 2 years old. I attended schools here from elementary school all the way through college, earning a bachelor's degree from Salem State University. I love the city of Boston. And like most Cubans, I'm a huge baseball fan. I love the Red Sox. I remember going to Fenway Park with my dad when I was a little kid. My wife is a pharmacist. She is also an immigrant from the Dominican Republic. And then, you know, I want to introduce you to some of my one of my colleagues who's here on this call today, who also has strong ties to the community. Samil Patel is the Director of Pharmacy and Retail Operations that oversees the Boston market. And he's been with Walgreens for quite a long time, including parts of Roxbury, living in parts of Roxbury for the last 24 years. Samil attended the Massachusetts College of Pharmacy, served as a pharmacist at the Warren Street store that closed earlier this year. Samil was also the pharmacy manager at our Walgreens store in Roslindale. He is very active in the community. He does support for Horizons for the Homeless, Children, and Victory programs. My regional healthcare director that supports the market, unfortunately, she couldn't be here today. She's on maternity leave. Hina has lived, her name is Hina Salim. She has lived in the area since 2003. She's also a graduate of the Massachusetts College of Pharmacy and served Walgreens in several roles, including as a pharmacist, a clinician, a district manager, a healthcare supervisor. She's also very active, helping provide immunizations for students in the Boston school systems. She served on the board, and she continues to serve on the board of directors at Massachusetts Pharmacists Association. The Massachusetts Pharmacists Association goal is to serve vulnerable communities and provide education and awareness around health services and expand care. So the reason I say that is because we care about our neighborhoods. We live here too. We're part of the community. Walgreens has been a trusted brand and a critical part of health and wellness since 1901. We were founded on core principles that every patient and customer is a guest in our store and should be treated with dignity and respect. We share a deep commitment to offering equitable access to healthcare in all the communities that we serve. In fact, today, over 75% of Americans live within just 5 miles of a Walgreens, with many of our stores located in underserved neighborhoods. So I just want to be clear up front that closing a store is never our goal. We are in the business of taking care of the health and well-being of our patients and our customers. And closing stores for us is always a last resort. Unfortunately, we closed the Warren Street store earlier this year because the current operating environment and our financial performance made remaining open at Warren Street financially impossible. Specifically, the Warren Street's closure was due to several factors, including the cost of operating and low prescription volume. Additionally, the lease term at Warren Street was ending, and we were facing a significant increase in rent, which was not sustainable given the financial challenge that we were already experiencing at that location. Unfortunately, since the pandemic, Walgreens, like many of the businesses you mentioned, have struggled financially. In communities across the U.S., retail pharmacies like ours are confronting many threats to their existence and a very challenging retail environment. Slower market share growth than expected is also a challenge for us. And there's also a pronounced labor shortage. All of that against a backdrop of lower reimbursement for pharmacy services. And just to kind of put a fine point on it, that pharmacy reimbursement pressure is real, and it continues to be a business challenge. A recent proposal by Mass Health Insurance is seeking to reduce our dispensing fee by 15%, and if adopted, would go into effect later this year. And that's not uncommon in terms of what we're seeing across the country. As a company, we've had to make other difficult decisions, including recently in the news, we announced a corporate headcount reduction, and one of several that we've done over the past 18 months. We announced this past week 256 corporate roles, leadership roles that we had to lay off. And along with that, we've closed many stores across many communities, not just Roxbury. Having said that, we know store closures are difficult for the communities we serve. Our customers and patients rely on our stores and trust our team members for their healthcare needs. And when we must close a store, we know it affects them and their community. So whenever we do close a store, our main priority is to ensure a smooth transition for our customers and our team members. We remain committed to our patients and customers across the Boston area. Our Warren Street store team assisted their patients on the transition of prescriptions, educated them about the many convenient services and digital channels that we have available. We have provided our patients and customers from the Warren Street store several different tools to help ease the transition so we can continue to serve their needs. When we close a store, we take several steps ahead of time of the closing to help our patients understand that we will continue to have access to their prescriptions. We contact every patient by mail and phone 4 weeks ahead of closing and let them know how and where to get their prescriptions going forward. I know Mr. Aduwu mentioned a notification timing and when folks find out. We want to inform everyone, but one of the key dependencies and considerations is to be very respectful of our team members who need to make important decisions around their employment. And we always want to make sure that we notify our own team first and foremost. Today, as always, we comply with all of the notification requirements imposed on us through all the regulatory agencies. In particular, the Massachusetts Board of Pharmacy regulation, which requires only a 2-week notification. We extend that. We do a 4-week notification. Ms. Williams mentioned that she hadn't received a notification even to this day. Ms. Williams, I apologize for that. Our plan is always to look at our existing patient base. So we check our prescription records for folks that have filled prescriptions in that Warren Street store. And we do 2 outreaches today. We do a phone outreach to those patients. We also do a mailer to all of the patients based on the information that we have in our pharmacy systems. Moving forward, one of the changes that we're making with subsequent closings is to include additional forms of outreach. Along with phone and mail, we're also extending and using electronic communication, email, when we have the patient's email address on file, and text as well is another option that we use when we have the patient's text information, their mobile phone number on file as well. And then we also do in-store signage. I know that it was mentioned that sometimes folks find out. Those are secondary and backup ways that we notify folks is by placing signs within the store. Specifically to the Warren Street closing that we did earlier this year, we took additional steps to help ease that transition. We delayed the planned closing of the store by additional 2 weeks to give patients and customers even more time to transition. We always do a free automatic transfer of prescriptions to nearby Walgreens of their choice. We specifically had their prescriptions waiting at the store that was on Columbus Ave, which was a mile down the road. We also offered in this particular instance, because we do prescription delivery as a service, we offered free same-day delivery of prescriptions to patients' homes for more than 90 days, even more than the 90 days that we had said. We extended that. We also do free same-day delivery for those patients on non-prescription products, retail products that they may need to their homes free of charge, same day for 90 days. We also provided assistance in downloading our Walgreens app, and we also help by signing up customers for our loyalty program to ensure that they have access to all of the promotions and delivery options and coupons that we have available. As it relates to our Walgreens team members from the Warren Street store, all Walgreens team members were offered the opportunity to work at one of our other nearby stores, and consistent with other closings, a significant number of them stayed working with Walgreens. In fact, the numbers from the Warren Street closing, we had 26 employees of record when that store closed. We placed 24 of them, and 2 decided not to stay with the organization. Like I said at the beginning, the closure of our Warren Street store has taught us a lot about how to best support a community during a time of transition. And as we have in recent months, as well as today, we are proactively engaging with communities around closures. We have taken your feedback seriously, and we agree that you deserve a meaningful dialogue with us around store closures. Our promise to communities remains the same as it has always been: the health and well-being of our patients and customers. And I'll close by just saying thank you for allowing me to join you today, and happy to go in more detail and answer any questions that you have.
Thank you. Sawmill, I don't know if you have remarks.
Yeah, just real quick, and just to allude on Aluf's commentary there. So as Aluf mentioned, I've lived here for 24 years. I lived on Parker Hill Avenue for quite some time. I worked in the Walgreens Roxbury location, including Codman Square and Rosedale, et cetera. One thing I want to hit on is how we're trying to just drive improved relations and do more stuff for the community of Boston. We re-engaged with the Boston Public School System for their summer jobs program, right? So it's something that kind of stopped during the pandemic that we tried to reinstitute this year with a lot of success. I started this company 17 years ago as a pharmacy technician, and we want to promote from within, et cetera. We want to provide high school students opportunities to hone in on their skill sets. So proud to say that, we've hired 41 BPS students. The other thing we're doing from a health equity standpoint is taking part in Boston's ABA health equity event in a couple of weeks at RCC. So just want to call out, my leaders are all engaged in working with the community here. We've worked in many of these stores as pharmacy team members and front-end team members as well. Thank you.
Thank you. Now we'll go to my council colleagues for questions. I do have one question for Aluf. You mentioned every Bostonian or everybody lives within 5 miles of a Walgreens. Has that distance, increased over the years? Is it around the same?
Yes, Chairman. So the statistic is a national statistic. It is something that you look at across the country. We have close to 8,600 locations, and based on where those locations are, we try to put pharmacies obviously where the population centers are. We do have many rural locations. But on average, that number, 75%, has been pretty consistent for several years. We did announce, and as it was mentioned earlier, a plan to close underperforming stores over the next 3 years. I believe the number that was stated by our chief executive, Tim Wentworth, was 1,200 locations over the next 3 years. So there could be a dip in that number, but that's the number as of today. 75% of Americans live within 5 miles of a Walgreens.
Is there any disparities when you're looking at cities with more affluent areas living in closer proximity to a Walgreens? I mean, it's an average, right? So an average, could be someone lives 0.2 miles. Is there any dip in different parts of neighborhoods inside of cities?
Yeah, not really. I think when you look at how we select locations, whenever we open a store, we always try to look for where we have population centers. We have data and analytics that looks at how many folks live in any given area. We don't target any area based on ethnicity or income level. It's really the density of the population that lives in an area, the amount of potential prescriptions and retail business that's available in that particular area that we look at to choose for where we go on locations. I don't have specific information in terms of breakdown by income level or anything like that. But I don't think that there's anything that would indicate that that number isn't consistent. And it's probably much less when you look at densely populated areas like Boston. My guess is that number would be less than that 5-mile radius that we have as a national figure.
I'll turn it over to Councilor Fernandez-Anderson. Councilor Fernandez-Anderson, or all councilors, you'll have 5 minutes. I'll go off screen. When I pop back on screen, that means you have 45 seconds left. Councilor Fernandez-Anderson, the floor is yours.
Thank you, Mr. Chair. With 5 minutes, it's going to be very difficult, but I guess I'll just put out all my questions all at once. Aleph, thank you so much for coming in to have this conversation with us. I did have trouble with some of the things you said in terms of your response. I understand the hiring, and I spoke with some of your staff, and they mentioned that it wasn't necessarily guaranteed job positions in other locations, and some of them was inconvenient and far away from their homes or school. In terms of closure, notification, and the extension, that was all done after the protest and after the city reached out through Chief Idawu. We asked administration to make a request, and then it was extended after days of trying to reach your administration or folks' executive office. And so I think the big issue here that I take with this is that we know that closures worsen medication adherence rates, and as residents face additional hurdles in filling prescription, leading to exacerbated health issues, right? So then you're talking about, vaccination rates dropping, access to over-the-counter treatments and stuff like that, and then leading to more or escalating to more issues that could lead to emergency visits for otherwise manageable conditions. But because of this delay or this interruption in their treatment for medication, and you're talking about communities that have a majority of people low socioeconomic class, and so we don't have to exacerbate those points about how the impact is detrimental. But then we're not asking for favors or handouts. We're asking that people are respected. As a corporation, that you make a lot of money, billions of dollars within the Black community, that you are responsive, that you are not just responding after people beg and plead and articles come out and senators are out in press conferences with us. And so, it does seem like this is a pattern historically, and now in 2024, people feeling disrespected, and Walgreens only responding after advocacy from myself, Councilor Well, and Council President Lou Jen, and my other colleagues here. And so I do, you didn't close one pharmacy in Roxbury, you closed one in Nubian Square on Washington Street, and you closed one on Warren Street. And then now we have the one on Columbus Ave, and people are saying that, there's speculations that might be closed too. So I want to hear about that. Do you know how many people used to use the one on Washington Street in Roxbury and the one on Warren Street in Roxbury, and how many people now have we disenfranchised? Do you know how patrons use the closing pharmacy were notified in terms of the communication from the beginning to the time that we intervened to ask you for the extension? And then our customers require us to change where their medications are sent to themselves, or are there ways in which Walgreens can assist with that and be proactive about, when you're closing, or is it left to them to call you and figure out that you're closing and then make those arrangements? Were any alternatives such as reducing hours or offering partial services considered instead of completely closing? Was there any community listening session or meeting or surveying or feedback gathering that you performed before making a decision? I mean, considering again that you benefited from this community, we would think that you would have more consideration in terms of like when you decide to stop making money at a place. And so, like, how does Walgreens just plan to support the district moving forward in terms of, you know, these proactive measures or other types of arrangements that could address their medication, health, or health needs? Are there any efforts at all? Any conversations around that? And then, you know, what outreach was conducted like prior to the decision making in terms of the survey and stuff like that? But just, you know, with administration and specifically the city of Boston, did you guys reach out to us? Are there plans to change the way you do things around that? And is there a commitment for Walgreens to make and prevent further closures in Boston? Or do you know already which locations you will close if you plan on closing more locations? I'll stop there. There are more questions, but I'll stop there. Thank you, Mr. Chair.
Thank you, Ms. Anderson, for the questions, and thank you for the opportunity to kind of clarify some of those pieces. I think the one thing to keep in mind in terms of like this process and kind of how do we go through store closures is, you know, the importance of our ability to continue offering services across all of the different locations nationwide. Because of the significant financial challenges that retail pharmacies across the country are facing, by necessity, we have to make sure, and this is not something new, we've been doing this type of portfolio review, looking at all of our store locations, making sure that all of our store locations are in fact healthy from a financial standpoint. We do a review continuously. One of the things that we do is really prioritize the notification of team members first and foremost. Out of respect for them, they're giving them employment choices. So before we communicate to any community group or other agency or anywhere else, we always want to make sure that our team members are informed. The review process is ongoing, and we've been doing this for quite a long time, looking at locations that are underperforming, looking at locations that you know, maybe locations where we want to move into because over time populations shift and move, and you know, one location may not be as good as a location a few miles away. So we're constantly reviewing the portfolio of stores, looking at what makes the most sense for the business to stay healthy over time so we can continue to care for patients, you know, not just in one store, but across the entire enterprise. That's a key component that I think we need to make sure that we state is, you know, the health of the organization allows us to continue to care for patients long term in all of our locations. In terms of you know, the outreach and what do we do with patients in terms of what do we communicate? We don't just communicate that a store is closing. Our communication is more robust than that, that says, hey, we're closing this store on Roxbury, and here's what's happening to your prescriptions and medications and all of the different services that you can take advantage of to be able to continue to use Walgreens as your pharmacy of choice. So when we close a store, because we are a national pharmacy chain and we have a single system that we use to fill prescriptions and track patient information, all of that information can be moved over. So if you have prescriptions at the Warren Street store and you have refills that you need to fill, we notify you in advance of when your refill is coming due and let you know that that prescription is available at the nearby location. In this particular case, the Columbus Ave store had every patient's prescription history and prescription information, including their next refill date. So we continue to do the normal notification that we do for all of our patients for those patients that are impacted by a closing store.
Aleph, sorry.
Yep.
Are you saying that with a reminder to renew your prescription, that you also said, by the way, this will be your last one because we're closing, or we're closing on this date, so hurry up and do this? Or was it just another reminder? Because no constituent mentioned, they literally said, we never got any text or phone call about closing.
I would say that we notify not just that, hey, this is your last fill. No, what our intent is to keep that patient within the Walgreens pharmacy system. So it is not just a, hey, this is your last prescription, but this is your new pharmacy on Columbus Ave. The benefit that we have having multiple locations across Boston and all over the country is
the text messages said, renew it, and by the way, you have to move over to Columbus Ave?
No, renew. You have a prescription that will be filled for you proactively at the Columbus Ave location. So the team members at Columbus Ave will...
You see the issue with that? Like how that doesn't actually explain that you're closing a location. So specifically, if we could stick to the topic of closing and better communication, and I guess, you already closed, but I'm sorry, our time is very limited. I'm so sorry, Aleph. I guess so we could get to the part about specifically what other locations we plan on closing, if so, and then the plans for improved communication in a way that is more equitable so that people can actually access it, but also be able to navigate it.
Yeah, in terms of future closings, like I said earlier, we continue to review all stores in terms of their viability. There's a lot of factors, like I said, not just financial, but there's lease obligations. Most of our stores are leased locations. We don't own the locations in many cases, so there is a negotiation with the landlord that also takes place. So, and those are ongoing. So when there is a final determination, we make sure that we communicate to our team members first and foremost, and then everyone else, just out of respect for the team members. But back...
Not getting a response about proactively communicating to people in a fair way. But also, if you don't plan on closing Columbus, if you don't know that yet, do you know that or do you not know that yet? And then, yes, I get the process that you review and then you decide, but you're not telling me whether or not you're closing another location.
Yeah, and our intent is...
Columbus Ave in particular, because all Roxburyans are now moved over to Columbus Ave. Like you have the people, elderly people with no transportation, paying Ubers or whatever they are doing to go. Yes. They prefer going in person. Now you have one location for this, huge population. Are you planning on closing that? Is that also not doing well, even though all the money is going to that one location?
Yeah, I guess to answer that question, again, we are reviewing all of our stores all the time. I can tell you right now that there is no current plans to close the Columbus Ave location, and be very clear on that. There's no current plans to close the Columbus Ave location, but that is not to say that we will stop reviewing store performance on a case-by-case basis to make sure that all of the stores are operating in a healthy manner that allows us to continue to serve all of our patients in all of our Walgreens stores. I guess that's the best way to answer it. But I want to be very clear on this point. We offer a number of different services to enable customers to continue to use Walgreens, whether it is in person, like you said, as a preferred method, But there are other ways where they can get their prescriptions, including delivery of their prescriptions to their
Customers are
homes.
saying that you're not treating them well, and they don't want to give you their money because of the way you've treated them, because of the way you've displaced them, because of the way you are pushing deserts, pharmacy deserts in the community, because you've actually commoditized this area, and now when you don't need them, you leave without proper communication. So why should they give you their business? They'll go to CVS, they'll go somewhere else, they'll go online, they'll go to their to their hospitals. It'll be inconvenient, but now they're saying Walgreens is a bad player. And I'm saying to you, you're not giving me the responsive because maybe you don't have the answer, and that's okay. And I know that no one here, again, is responsible for the closures, but the processes to which you communicate to customers, to respect them, to say, we've made money out of your community. We understand that this is a disparate community and have all these issues. And for that, we know that we have to address our customers in a more equitable sense. You don't have that consciousness, that level of like customer service, and they have felt it and they are suffering for it. And so I think here, I don't think I'm going to get the answer to those questions, but I'm going to heed to the time because I know that my colleagues have questions as well, and I appreciate you being here to answer. Thank you.
Thank you, Councilor Anderson. And Aleph, I do have a question. You say you review stores. Is it annually? Is it quarterly? How often?
Yes, Mr. Chairman. We review on a regular basis. We have
every day, twice a month.
Not every month, but on an ongoing cycle, probably once a month. There's reviews, and be mindful. It's not just a decision on whether we decide to close or not a location. There are many efforts that we look at in terms of what else can we do, because I know that question came up in terms of it isn't just a close or no close. There is what else can be done operationally, right, or from an investment standpoint to make a store more viable overall. So there are ongoing conversations as we look at our store base to make sure that we are doing everything we can operationally or any other type of investment that we can make in stores to make them more viable from a long-term standpoint.
Got it. So when you review stores on a monthly, annual basis, and you're trying to make them more viable, do you put them, like, how do you categorize them? Like, what categories do you put those stores in? Like, is there ones that you say this store needs improvement in operations, that goes into that category? This store needs more improvement in staffing. Like, how do you, after your analysis, how do you categorize them?
There is a lot of different factors, Mr. Chairman, not just a category. There's a lot of different levers and different initiatives that we can roll out. Staffing has been a challenge, as I said earlier in my opening statement. In particular, pharmacist staffing has been a really big challenge for us. So if it is a staffing challenge, we do have incentives and recruiting tools that we use to try to recruit more pharmacists and more of our healthcare folks that can work in those stores. If it is a challenge with the lease contract, we do go to landlords to try to negotiate more reasonable terms. We do investments in the location itself. In some locations have partners that we work with to try to help the location overall. So there's a number of different things. I couldn't say that there's a category. There's so many different levers that we can pull, both operationally and from an investment standpoint.
I'm taking a lot of liberty as the chair. So I guess my last question to you is, and this is kind of this dovetailing off of Councilor Fernandez-Anderson's, do we see any challenges with the Columbus Ave store? Do we see any staffing challenges? Do we see, like, when's the lease up for the Columbus store? What challenges do we see in the Columbus Ave store?
Yeah, I guess I can say that the one thing that one of the things that Ms. Anderson mentioned is, how many patients have we been able to keep? A very significant number of patients that filled their prescriptions and shop at the Warren Street store have migrated and stayed with Walgreens because they're happy with their service at Walgreens. And that migration of patients and customers has strengthened the performance overall of the Columbus Ave location, which makes it a much more viable location overall, and bodes well for the long-term prospects of the Columbus Ave store. So, and that's what we historically see when we are faced with those decisions where we need to close a store, is that many of the patients that have filled their prescriptions at Walgreens appreciate the service, like the service, and stay with Walgreens in the new location for a long time. So that the Columbus store has benefited significantly from the Warren store closing.
All right, because I get a little bit nervous when you say there's no categories, but then you use terms like strengthen the performance, right? So I get a little bit nervous because it sounds like there are categories of stores and how they're performing. But I'm gonna go to Councilor President Louis Jen. The floor is yours.
Thank you, Mr. Chair, and thank you to my colleagues for asking great questions. I think I want to pick up on the thread that Councilman Anderson started when you were talking a little bit about the criteria for the decision to close or not to close a store. Obviously, I think it's fair to say that profit and profitability is an important metric for you as a store to consider. But are you, and especially in your remarks, you talked about being part of and in the community, but I didn't hear in the criteria for closing a store, keeping it open, is a commitment to community. And I'm wondering if it's because there is inherent tension in that commitment to community, right, which is often rooted, especially for Black and Brown communities, in a need for equitable health services, and the desire for profit. Like, where is that consideration for commitment to community that was talked about in the beginning in consideration of when to close a pharmacy?
Yeah, I think back to your question when you say commitment, and we talked about that 75% of stores within 5 miles, over 50% of our stores are in underserved communities. So half of our store base sits in underserved communities. So definitely
what's the criteria for that definition of underserved? Do you know? I'm just curious about what metric you're using for that.
Yeah, typically where you would see that there aren't a lot of pharmacy options, and and that typically coincides with income levels and what you would term as sort of a pharmacy desert type location. That's where we have over 50% of our store base. To your question around the profitability of the store, I can't overstate the importance of Walgreens overall as an organization being financially successful, right? We cannot, as an organization, run stores that are losing money, that are not that, and that's when these stores close. It's not that they are not making enough money. These are stores that are losing money. These are stores that every day we open the doors, we are negative from a financial standpoint. And if you have an organization that continues to operate stores at a loss, then you're not going to have an organization for long. So I think when you're looking at the overall ability to care for patients across all of our stores, it's important. And I think everyone would agree that it's important that the organization as a whole can continue to do that and provide that service to patients in all communities. by making sure that, stores that aren't financially viable, that we review and try to see what we can do to change that picture around. And in some cases, unfortunately, when we can't change that picture around, we have to make those difficult decisions. But I think overall, for the overall good of the organization and our ability to continue to care for patients across the entire enterprise, it's important that we continue to do that.
Thank you. I hear you. And I just wanted to just draw that that the priority for you, again, is about that bottom line and not about community. And I think that's important. My next line of question, actually I have two questions. And Jagdeep, I think this is, I wanted to drive that point home because it underlines how important it is for us to be investing in those federally qualified community health centers. And you talked a bit about it in your intro. I'd love for you to talk about I'd love for you to talk a little bit about more what that investment looks like, given that pharmacies that are part of these organizations that care about bottom line, whether, we're obviously not, government isn't investing in these organizations, these corporations, but what can we be doing more proactively on the front end, knowing that corporations don't have community at the center and that's all of you? How does that look like in terms of investment? And then, I guess Chief Idowu, if you had a comment and wanted to add on that, that would be good. And then my second question is to Danielle. Thank you so much for being here and for bringing up how this connects to Carney, because I think, and I want to see this ordinance and work on it, because I think it's a really great idea, even though Carney flouted those requirements that we had at the state level, right? They didn't give the 120-day notice and they just did what they want. So I just think that even when we have the laws and regulations in place, there's a discussion we need to have about the lack of respect sometimes that corporations within our boundaries, whether it's private equity or a Fortune 500 company, that we recognize when they're providing services that are important to our residents, that what are we preparing to do when their profit model isn't one that cares about community? And so just a little bit about we implement the ordinance, we have it, but then we still see, corporations and organizations, private equity and healthcare flouting those same laws. So those are my final two, because I know that my time will probably be up after that.
Yeah, I think the partnership that we have with different communities and services across our organization is vast. We do a lot of work to try to care for patients and help patients, allow them to have access to their healthcare needs, whether that be pharmacy or other. We have partnerships with health systems in different stores. Even within this region, we have partnership with Hartford Health and other folks that help us provide services to customers and patients that allow us to leverage partnerships and different organizations to help bring healthcare to the local level and allow folks to access healthcare, not just pharmacy. We have partnerships with many, 340B entities that help us provide to low-income patients and do that in a way that, puts patients first. In terms of what can be done from a government standpoint in order to, allow us to continue to serve and continue to do things, like I said earlier, I think one of the biggest challenges that not just Walgreens, but pharmacy in general, and this goes for chains like Walgreens and CVS, which is also closing a large number of stores. But you also think about independents and other pharmacy providers. One of the biggest challenges that we face is pharmacy reimbursement. And when you see things like, Mass Health looking for ways for them to reduce the amount that's reimbursed to pharmacies like ours that are already challenged from a pharmacy reimbursement standpoint, those things are meaningful, and those are the types of things that make it difficult for us to be able to provide health services, to provide prescription services long term, when the compensation that we get for doing those services continues to be reduced and challenged. So those are significant things that impact our viability long term.
Thank you so much, Alef. I just want to make sure that my time is limited, and I want to make sure that Jagdeep and the chief and Danielle are able to answer the questions that I targeted towards them. So
yes,
thank you.
Thank you, Council President. And I'll try to be as brief as possible. I think one of our biggest hopes is an outcome of this is that we, as partners with the city, and as we partner with the city to work with these for-profits who inevitably will close. Many of my colleagues at other health centers had received letters and notices that the pharmacies that were run within their health centers were being removed by the CVS's and the Walgreens, again due to that profit margin, and then we're left to still hold up those pieces. We are historically financially burdened and financially strapped. It is nothing new for health centers that we have to then come in and step in and do the right thing for our community. We at Upham's operate at a loss. We do, and we're not going anywhere. And so how do we learn from these corporations that when they have to shut down due to their business decision, doesn't matter what it is, they still leave us with a desert to continue to serve our people? Give us enough notices, let us take over your leases, let us work with the city to work with those landlords to help support our community so our patients aren't becoming non-compliant on their medication adherence. There are multiple levels and degrees we can go to help do better by our community. And we just need to be at the table and not be thought of afterwards to help pick up the pieces. Again, we're talking about pharmacy today. 2 months ago, we were talking about Kearney closing and no one able to step in, and the Kearney's pharmacy just up and shut down, and all of a sudden that pharmacy had to find a new home. It's not right. and to invest in the community health centers that have been here and will continue to be here, but we can't support our own staff. And at Upham's, 65% of our staff live in the city of Boston. So not only are they our employees, they are our community members, they are our patients. Maybe not at Upham's, but they are our patients in health centers. 1 in 7 community members is a health center patient. That goes to say something, and it should say something at a grander scale. And we just need to continue to be at the table and fight for our voices. Thank you.
Thank you.
And I agree. And just to restate that, one of the things that we want to continue to do is to continue to partner with folks within the community to find the right solutions to care for customers long term, right? Not just short term. Part of it is us allowing us to be able to serve them at a different location, but sometimes it may be to partner with other folks to try to make sure that those patients are cared for, and we're committed to continue to work proactively with the community on our stores and how we care for patients long term. So we absolutely want to be a partner in that effort.
Danielle, I know I had a question then.
Okay, so I guess my quick answer is when I worked for Felix Arroyo Sr., there was a snowstorm. I fell on on someone's property, and it was 2 days after the snowstorm, and they hadn't shoveled their walkway. And when I went back to the office, we did some research, and we found that the city had an ordinance that people thought was pretty archaic, and just didn't pay attention to it. And if you notice now, whenever there's a snowstorm, there's a conversation about making sure people are paying, making sure people are clearing their walkways. So I feel like when we think about legislation that an ordinance, they're basically ideas that come from the community, and then they're turned into an ordinance or state legislation. And we, let me finish. Let me think. And the legislation that we write is to protect people, right? So when I'm talking about this 90-day ordinance, it's to protect people, and it's to be proactive so that people are not literally falling in the snow to get medication because they don't know where to go once the store is closed, a pharmacy is closed. Yeah. So I feel as legislators, you have the right to protect us. That's what we sent you there for.
Thank you, Danielle. And I think that it's a great idea, and it's important that, you know, that ordinance would allow us to do what Jagdeep was talking about. Don't just leave us in the lurch, right? Like, if we are put on notice, then we can create a plan. Then the chief's office can work to think about what does a plan look like, other than like, here goes a Foot Locker, right? Yes. So I look forward to working on that, and I just thank you for your advocacy and for making sure that you got us all together, both protesting and now today. So thank you, and thank you again to everyone for being here.
Thank you.
Thank you. And I guess my line of questioning earlier was kind of, I think 90 days. I'm just kind of like just hearing, you know, there's annual assessments done on stores, right, to kind of understand like their performance. It just feels like 90 days could be extended more out to like 120 days, just based off of, you know, Walgreens constantly analyzing these stores and knowing that, you know, these stores might not be meeting their criteria, you know, month after month, year after year. So I do think there might be more time that could be added into that notice so that the city and other partners could get things in order. Councilman Mejia, the floor is now yours.
Thank you, Chair, and thank you to my colleagues for all your really great questions. And Danielle, it's always great to be in community, especially when we're fighting for the things that we need to get on the record and get people to understand that it's definitely going to take all of us doing this work. And I really love your example of understanding that the best solutions oftentimes do come from the constituents that we serve, and oftentimes it's because what we're trying to do is protect those that we serve. And the best way that we do that is by honoring them. And making sure that we're following up. That's what accountability is all about. And I really do appreciate the note in your earlier statement when you talked about the issue around the snow ordinance that was already in place, but that we didn't know about it. And we recently came across another issue on the council where we believe there was a fund that was in existence, but it wasn't in existence. It was in the charter, but it wasn't really law. So our office has been doing a lot of work around auditing our own pieces of legislation that we've passed, you know, just to make sure that what we have proposed is actually working. Because what's the sense of having things in place and patting yourself on the back? Oh, we passed this, but, you know, is it really meeting the moment? So we've been really aggressive on our own stuff just to make sure that if we need to change things up, that we will. And so, you know, right now I'm working with Councilor Anderson and Councilor Roel on establishing an Office of Inspector General, which our hope is that through those efforts, we would have some form of mechanism to not just do audits for the sake of accountability, but efficiency. And like, some of these things were written in 1907 and we're in 2024, right? So what do we need to do so that we can upgrade and update to meet the moment? So I really do appreciate you bringing Felix Arroyo Sr. into the space in your work, because it really provides a nice historical perspective of how we ended up here. So thank you for all of that. But on to some of my questions, though, because this is what I'm here to do, is ask some questions to the panelists. And I'm going to start off with Mr. Gutierrez. I'm curious, in 2022, when we first kind of felt the situation with Walgreens. I think it was the one on Washington Street. I think that was the first, if I remember correctly. We wanted to work alongside Pharmacy Lux, which is it is a for-profit small mom and pop pharmacy. I'm curious, as you kind of grapple with whether or not you're going to remain open and closed, how is Walgreens working with the surrounding community, the small businesses in the surrounding community, excuse me about that, in the surrounding community to help either find ways to help support those businesses? Like, what kind of conversations, if any, you all engaged in 2022 with some of the surrounding smaller mom and pop pharmacies and or community health centers or Boston Medical? Just curious.
Yeah, I can't get too specific about a specific effort in a community, but I can tell you generally how we're structured in our field operations, which I'm a part of, is that we have district managers and store managers that part of their responsibility is to be a active part of the business community. So having relationships with local communities is very much in line with what the expectations are of our district and store managers. Our district managers regularly attend meetings.
Let me ask my question. I'm sorry, Mr. Gutierrez. I want to make sure that I'm very clear with what the question is. I want to know in regards to the potential closure, I'm asking specifically what type of engagement did your district leaders engage in with the smaller businesses and the community at large in that specific, in the area, to think about from a strategic planning perspective, how can this, if you were going to do this, how can you do this in a way that would help support Black and brown, particularly small mom and pop shops and or community health centers? Like what was your game plan around the strategy there, if any?
Yeah, we have regular outreach to our neighboring businesses. They, part of what makes a community is the fact that we're in their stores, they're in our stores on a regular basis. Once we are able to share broadly that a store is closing, and like I referenced earlier, our first line of communication is to our direct team members and letting them know. And once we do that, then we're able to then let others know, because we absolutely don't want our team members finding out from anyone other than their supervisor that their store is closing, because there's decisions and options that they have. So that's step one. Once we get there, then there's conversations with everyone else that...
Mr. Gutierrez, they're going to put me on, I have a very limited time. So then basically the question is, was there, yes or no, a concerted effort to work with some of the small businesses in the area to provide a pathway to help support those smaller businesses while also supporting the community? Yes or no? Was there a concerted effort?
I guess it depends on what effort you're thinking of, and maybe I'm not clear on.
Yeah. So my effort, what I'm trying to see, right, is that when something's going to happen that is traumatic to a community, there's always some strategic planning or some crisis management put in place, where we look at how can we do this in a way that is not going to harm the community. And so when I think about harm, I think about financial harm, I think about physical harm, I think about health harms, right? So if there was an opportunity for Walgreens as doing business in Roxbury, and there are maybe 2 or 3 smaller mom and pop pharmacies that you were able to collaborate with or connect with to support both our constituents and these small businesses, so that they can maybe transfer over, instead of transferring them over to Columbus Ave, if there was another pathway towards maybe transferring them over to some of the smaller mom and pop local shops?
Yeah, I guess the way I would characterize that is, from a business standpoint, I think our preference is always to try to take care of our customers who have been loyal customers to Walgreens to stay within the Walgreens network.
Yep,
But we always default to patient choice, right? The patients have the ability to go wherever they want to go, and so do the front end customers. They have the ability to go to wherever they want to go. And wherever we know that there's a choice, we don't impede or do anything to limit their options. There are many times when we close stores where we get requests for prescription transfers to other locations, and we absolutely support that. So if a patient said, hey, it's just not feasible for me to get my prescriptions at the Columbus Ave store, and I'd like to, go to this pharmacy, we always oblige, and the principal priority would be to make sure that patient continues to get their health services cared for.
Yeah, thank you, and I appreciate that. I guess all of this to say, Mr.
Gutierrez, yep.
Gutierrez.
Yep.
Discúlpame. ¿Tú hablas español también?
Gutierrez, sí, yo hablo español.
Okay. I'm not, don't worry, guys. I'm not going to be speaking Spanish up in here. Pero mira, real quick, I see Councilor Roel putting his face back on. That means I got 30 seconds. But listen, I just want to say is that I think what I'm struggling with in this whole process is that I understand that we're in the business of making money, and I appreciate that. What I'm struggling with is that the impact that these closures have had on communities, particularly vulnerable communities and communities of color, that there was an opportunity to be a little bit more mindful of how you do this in a way that everybody feels like they're winning, right? And I think that if you're gonna cause harm, you have to also think about the impact of that harm. And if there was another way for you to go about doing it, I think that this conversation would have looked very different, right? And I feel like that's why we're having this, this conversation. And in terms of 90 days, I think that we need more than 90 days. I think, I think that communication is one of those things that it takes a while. And Chief Iriwu, you know this, right? Like we put out information about all these things that we're doing, and sometimes people still don't hear them, and then we send them every single ways that we can possibly imagine. So I think that Walgreens, I think that we need to do, I think the time needs to be more than 90 days. That would just be my recommendation. And then I also think that we need to look at the infrastructure and how we're going to measure the success of that communication. And I just would offer us to consider that. And I'm going to respect the time, and I really do appreciate the indulgence. Thank you.
Thank you, Council Mejia. I will now go to my council colleagues for second round of questions. If you have a second round of questions, please raise your virtual hand. Council Mejia, okay, perfect. Council Fernandez Anderson, the floor is yours.
Thank you so much, Mr. Chair. For Chief Iriwu, I just wanted to draw attention to the location on Warren. And if you could enlighten us as much as you are able to disclose here about what's going to go on Warren Street, and how do you feel that this will mitigate some of the harms?
Sure. Well, I won't disclose at least the name of the company, but it's a local vendor that's moving in to expand their grocery store business. And after a conversation with them related to, again, based on the work that Danielle and other community members and yourself, Counselor, they, obliged us and included a pharmacy component to make sure that the neighboring residents did not lose out on that access.
Thank you. Does the city of Boston, and I'm sorry that I have not asked for this on outside of this hearing, maintain a list of active pharmacies or urgent care centers and other medical pharmaceutical facilities?
Yes, I believe through the Boston Public Health Commission, there is that list.
Okay, awesome. I guess, Mr. Chair, I could always email directly, but if we can get folks to send out a request for us to get that list, I think that would be helpful. especially if it's by neighborhood. And just going back to Walgreens, moving forward, where do we stand in terms of like city getting notifications and improving those practices, or encouraging them to improve those practices?
We continue to do our part to communicate both to the patients and customers of the stores, as well as the city government, the Board of Pharmacy. All of those communications are part of our existing closing process, and we will continue to do that in a respectful way.
The question is, do you notify the city? Did you notify the city? Will you notify the city if you don't? And how much of a heads up will you give us?
Yeah, and we have a government relations team that works directly with local government to share. And we absolutely, in our Warren Street store, we did notify the city. And when these come up in the future, we will also do the same and continue to notify and be respectful of the different partners that we have at the local and city government.
And after all of this has taken place, with two Walgreens being closed in Roxbury, just in one neighborhood within a year apart, what efforts have you made to communicate with the city for future proactive efforts?
We are going to continue to work closely with the city. We have a direct line, and we did with Warren Street, communicate with the city on multiple occasions regarding that closure, and we'll continue to commit to do that. That's not something that we plan to stop. I think that's a very critical relationship for us as we continue to be a partner in the business community of Boston and the Roxbury area. So it's important for us to continue to do that, and we will continue to do that.
Thank you. To Ms. Johnson, Ms. Danielle, how can we, I guess, in the future and today, continue to advocate for corporate accountability measures? Do you have any suggestions today for Walgreens, or recommendations that you've heard from the community?
You asked me?
Yes.
I think one of the things is, I don't know if they have a community engagement officer, but I think that's one of the things. They have someone that's like directly connected to the community, that can give information that is going to inform their decisions, and especially around closures. I mean, the closures are extremely sensitive, right? There are people that have, like myself, that trusted Walgreens for years. I was a customer of the Walgreens in Roxbury for over 20 years. I raised my kids through services at that Walgreens. So Walgreens has become like an entrusted member of our community, as well as our families. And there should be a certain sense of respect that is mutual. And I feel the way Walgreens closed in Roxbury just was extremely disheartening. And I don't feel that customers such as myself felt valued. And like I said, I'm still waiting for notification, and it's even more disturbing that notifications went out as text messages, emails, and phone calls, and I never received any of those, nor did my dad. So there were many customers besides myself that felt extremely disrespected and devalued.
Thank you so much. I guess I'll stop here, Mr. Chair. My last question for this round is to Jagdeep and Ms. Danielle. What do you think, or in your view, what would an ideal solution look like to maintain pharmacy access for residents in Roxbury? Jagdeep, if you want to take it on, and then Danielle.
Sure. I think a discussion with the health centers in those areas to see if there is any opportunity for them with support from our elected officials, our city, our state, to open, a standalone pharmacy site to help continue serving the community. I think that is an avenue we would like to pursue.
And Aleph, is there any interest from Walgreens to do that?
Ms. Anderson, we always coordinate and communicate. And to the question around, do we have a local partner that engages with other businesses and the city and local government? We do, and he's actually participating in the meeting. He's not on the panel. But he lives in the Boston area and supports us from a government, local, and state relationship. His name is Denovan. You may be familiar with Denovan, but he supports us, and he is our liaison that represents Walgreens with local and community affairs. As it relates to working with other pharmacies. And like I said before, I think one of the things overall, we're taking the approach that when we close a store and we have patients that have done business with us for many years, and we have the ability to continue to be their pharmacy of choice in a new location, that is going to be our first opportunity, is to keep them within the Walgreens family. Having said that, we don't restrict them from using any other pharmacy, like I said, or any other health service or health system within that area or anywhere else that the patient chooses. It's always the patient's choice.
I think the question, sorry, Aleph, I think the question is about the one you went back to. Ms. Danielle was asking what, so what if you had a community engagement person that could engage the community in a more proactive, more efficient way? It sounds like your community relations person or liaison has not done that, and we're saying that the community feels disrespected, that was not executed at all. And the suggestion or recommendation was that you create one. If your liaison is not within their job description or purview, then it needs to be added. It's a recommendation because we're saying it doesn't exist. But thank you, Aleph. And Jagdeep, I really appreciate that conversation. It sounds like there's a disconnect. Obviously, if the recommendation is connect with health centers, build this partnership, talk about how we could do this more in an ecosystem, more holistically, so that it works, so that there's synergy in service, so that people feel respected. It just sounds like there's a disconnect. And Aleph, your responses today has continuously, it almost sounds like a commercial, and no disrespect to you, but the message from Walgreens today feels like it's propaganda. It's not real. It's not happening. The community saying it's not happening. There were protests, multiple protests. Senators came out. There were news articles about this, and so I think it would be sort of the next steps on how to build better partnerships, not claiming that a thing is happening, because it almost feels like the community is being gaslit. But I understand, and thank you. And Chief Idu, I thank you so much for your time and your continued partnership in looking at local businesses and figuring out how Boston can also take responsibility in holding corporations accountable by us being proactive in figuring out other ways of opening smaller businesses to address the community pharmaceutical or medical needs. So I thank you for this meeting. I have no further questions, Mr. Chair. I thank you, Ms. Danielle, thank you so much for your advocacy. The fight, we were out there in the protests, in the press conferences, in the listening sessions that we held, And all of this work and collecting information and working with Council President Jen, Council Worrell, Council Mejia, and us figuring out, how to go back and forth and then looking at us possible legislation. We will continue to work with you. Sounds like Councilor Jen has an interest. If she could take the lead, we'll talk further and figure out where we go from there. And Council Chair, Mr. Chair, I thank you so much for facilitating this hearing. For me, I think I have the information that I came for, and Walgreens, I encourage you to continue to, or try at least to change your trajectory here in terms of how you address Black and Brown communities and performing business here in Boston. It does, again, I'm not going to beat the dead horse. It just feels like you've failed to ensure the community that you respect them, and that when you come in to do business and take their money, that it is just that. It is, as Councilor Jen mentioned, it's about the bottom line. If you are not making money, you got to go, and then everything is done in a fast and a hurry, and people feel disrespected, people are hurt, and then people are also impacted negatively with their medical situations. So I hope you take that to your higher ups and let them know that this body is not happy with Walgreens. Thank you, Mr. Chair.
Thank you. Councilor Mejia, the floor is yours.
Thank you. Oh, I see that Councilor Louise and
it's actually my fault because Councilor Worrell did ask.
You had to raise the hand.
Raise your hands, and I did not raise my hand. You raised your hand, Councilor Mejia. You should go first.
Councilor Mejia, the floor is yours.
I think because you are one of the original co-sponsors, I can wait my turn.
No, I called on you, Councilor Mejia. The floor is yours.
Okay, sir. Thank you. Just want to make sure that I follow protocols and procedures here. I just had a quick question and a clarifying question for Chief Idu. You had mentioned, I know we can't disclose who. I just want to just go on the record that, when it comes to locations and opportunities, that we're always thinking about Boston-based franchises and or businesses and individuals. So, just want to just uplift that. There were several folks who had reached out to us in regards to that space, and some of the advice that I provided is that, it better be something that has to do with the pharmacy. But I'm just curious if you are going to be prioritizing Boston-based businesses in that area. Just for the record, I just want to just hear that and walk away confirmed. Yeah.
If you're talking about the group that I think you're talking about, we were in conversation with them as well to be as supportive as possible. But I think as folks on the call know, these are all privately owned properties, and so we advocated on their behalf with the landlord. The landlord decided to go another way, and then when we discovered who was going to take over that space and the purpose, that's when we engaged in conversation with who was taking over to say, you may have seen that a lot of folks are upset that the pharmacy is leaving, and so it would be really important for you to include that as part of your plans, and they heeded that advice. But yes, always, as the city of Boston, we will always prioritize Boston-based businesses.
Yeah, and I think to Danielle's point, the reason why we're all here is really making sure that we learn from these mistakes, right? Because when people are invested in our communities, when they are from our communities, then they do right by our communities, right? So I just want to reiterate, while I do appreciate and understand the landlord situation, I also understand that as a city, we also have ways and levers that we can also hold those who want to do business here. That we do. I don't think that I don't know. I'm not going to belabor the point. I just want to make sure, and I want to be on the record that for me, it's really important for businesses of color and people from Boston that get priority and support. And so I just want to, I understand. I'm going to let it go. Okay. It's all good. I'm just going to let it go. I'm just noting it for the record. And then the last thing that I'm going to say to Mr. Gutierrez, I know people butcher Mejia all the time, so I know how you feel right now, is that, I am a little bit disappointed in terms of the way we have shown up here in regards to this specific conversation. When I was asking questions specifically about the role and what we could have done differently, I feel there was somewhat of a disconnect or lack of commitment to this particular community. And I'm just hoping as you continue to navigate these spaces and places, and I'm going to assume you're going to be in other spaces that have been impacted by it's health deserts here, that you are super mindful of how you're showing up. And I really do appreciate that you love the Red Sox and that you dropped so that you might be half Dominican and half Cuban. I appreciate all of those things, and that you speak Spanish. I'm always one to say there's one thing to be of color and then the other one is to live in color. There's two separate things, and it's two very different ways in how we show up. And I just want to just offer that feedback that, I understand that you understand what you're walking into, but I think that the people of Roxbury in particular would appreciate Walgreens showing up in a real way for us in this moment. So I just want to offer that feedback as you continue to navigate these spaces. And I would not be who I am if I didn't keep it real. So there you have it. Thank you.
Thank you, Council Mejia. Council President Luigi, the floor is yours.
Thank you, and apologies for the mix-up earlier. I didn't really have a question. I just wanted to reiterate why I think this is so important. We are in a health crisis in terms of accessing health care for our Black and Brown communities. And I think that it requires us to double down on our investments and what we're thinking about community care looks like. I was deeply, the closure of the Carney, the closure of these Walgreens. And I just want to say that I look forward to the work ahead alongside Jagdeep and alongside Danielle's particularly, because recognizing that we are in crisis in a space where probably profit should not be the driving point generally in healthcare. And I think that's at the end of the day, whether it's Walgreens, whether it's another corporation, that is the driving issue here. And so I look forward to the work that we can do on the city side and working alongside with our state partners to really think about what alternative investments look like, because I just think that we can't rely solely on entities that are driven not by community care in a way that is so important to us. So just not a question. And again, Chair, I apologize for earlier, but I just wanted to just really underline that. It's not about finger pointing per se, but it's about recognizing the crisis of healthcare that our communities are in, and that we have to do something, and it has to be sort of disconnecting community care from what does the bottom line look like? And I think that's why we're having, one of the reasons why I care so deeply about this, because we see so much hurt and pain in our communities when the bottom line is the driving force. So thank you, Councilor Fernandez Anderson, for your leadership here. Thank you to all the community members who are really fighting every day to make sure that our communities, that we stop the harm. Thank you.
Thank you. Councilor Fernandez Anderson, the floor is yours. You're on mute, Councilor Fernandez Anderson.
Apologies, Mr. Chair. I just wanted to thank everyone once again, but wanted to just go back to the point that Councilor Mejia was making about the business going there. As Chief Idu had mentioned, I mean, since it's in my district, I just wanted to touch base on that. Since it is in my district, I realize that at large, all districts are your districts, but I was very intentional in terms of, looking at the different businesses that had interest. Obviously, it's not my choice. It's not Chief Idu's choice. It's not the city's choice. It's a private business, private, landlord. They get to choose who they want to rent to. However, we have a trend here in Boston where we see a certain demographic of businesses opening franchises and multiplying. And that would be with certain, I'm just going to say certain demographics, where immigrant demographic that is opening businesses and multiplying, but then we have not prioritized African American businesses necessarily. And yes, they are private, and we have very little control, but I think that this sparks a very interesting conversation about how we can be more intentional in ensuring that if the Black African American population here in the United States, here in Boston, have paved the way for immigrant population. And you can see with the Boston Foundation study in terms of housing and how the immigrant population really drives the population here in Boston. However, we seem to dilute the conversation of equity every single time when it comes to African American people or Black people owned businesses. So the business that is going there is Black owned. The alternative businesses, I think, have a franchise, and I advocated for equity in the end. And so hopefully that I did the fair thing. Again, ultimately, it's not my decision, but I wanted to speak up about that because we do have to be intentional in seeing, like, we see all of the, liquor stores and the trends and brothers markets and other businesses that are opening multiple franchises all over Boston. Plenty of opportunity for them to build and equity and whatever assets, which is great, which we want that. But we do have to look at it with a fair, equitable lens and making sure that we are advocating to distribute the space and opportunities to create economic mobility for all in the city of Boston. So as the district councilor, I just wanted to address that and say that I'm perfectly aware of who's going there, and I'm perfectly aware of who was advocating to go there, although it wasn't my choice. Thank you so much, everyone, for this conversation. Ms. Danielle, again, thank you for all of your hard work and hard work. And I look forward to working with you in Councilor Lujan's office, hopefully on looking over that legislative piece. And Mr. Chair, thank you so much. Walgreens, Jagdeep, Samuel, we really appreciate you being here today.
Thank you. I do want to give a big shout out to a State Representative Worrell, who is pushing this on the state level to make sure that there is there's more communication from retail pharmacies to the community on the state level. So just want to give a big shout out to State Representative Worrell for his work on the state side. Now we'll be moving to public testimony. You'll be called in the order in which you signed up. Please keep your comments to 2 minutes. When you hear your name called, please state your name, any affiliation, and please direct all your comments to the chair. Jawan Skeens, the floor is yours. Please raise your hand and you'll be promoted to the panelist.
Thank you all so much. Can you hear me okay?
Yes.
All right, give me 1 second. Just trying to pull up my notes here before I get started. Give me 30 seconds. All right, thank you so much. Good afternoon, Boston City Councilors. I hope this message finds you well. My name is Jawan Skeens, a lifelong resident of Dorchester and leader of the Prophetic Resistance Boston. I am writing to express my unwavering support for the 90-day pharmacy closure ordinance under docket 0183. I would appreciate it if, basically as a member of Dorchester in the greater BIPOC community, I'm deeply concerned by the recent closure of the pharmacy in Nubian Square, particularly on Warren Street and Washington Street. These pharmacies are critical to the health and well-being of our community, and their sudden closure without proper notice puts lives at risk. The impact of these closures is more than just a mere inconvenience. This is a matter of life or death. In Roxbury, the average life expectancy is only 68.8 years compared to 92-year in Back Bay at a 23-year disparity. Chronic diseases like cancer, diabetes, heart disease, and stroke can contribute to 56% of mortality in Massachusetts and disproportionately affects the Black and brown communities. To make matters worse, many of our neighbors rely on these local pharmacies for essential medications to manage these life-threatening conditions. When pharmacies close without proper notice, it denies vulnerable residents the time and resources they need to transition their care. The lack of transparency is unacceptable. It shows a blatant disregard for the lives of Black and brown residents who are already grappling with systemic health inequities. Closing essential pharmacies without giving proper notice does not just inconvenience people, it endangers their lives. This is not just about healthcare access, it's about racial justice. We cannot afford to let such gaps in care go unchecked as they contribute to the preventable deaths of too many people inside of our community. I want to also highlight the growing demand from my neighbors to build and sustain a culturally competent care system with our community. We are not just asking for better access to medication, but we're asking for a healthcare system that understands and addresses our unique needs. One potential solution that has been discussed is the creation of local Nubian Square Pharmacy, one that prioritizes the health of Black and brown residents, both in terms of access to medication and preventative care. In conclusion, supporting this ordinance is about saving lives. It's about protecting the most vulnerable members of our community, ensuring that they have the time and resources to make the necessary transition with their healthcare options when their healthcare options are disrupted. This ordinance is the first step towards not only protecting lives today, but towards building a healthier and more equitable future for Nubian Square and all of Boston's Black and BIPOC residents. Thank you all for your time, and I hope that you support this critical effort in making this change. Thank you.
Thank you. Mike Wilson, the floor is now yours.
Good afternoon, everybody. I've interacted with many of you over the past couple of years on this issue. My name is Michael Wilson. I am one of the owners of Crawford Drug. We've been servicing the Dorchester community as an independent pharmacy for well over 50 years. I am also the president of the Massachusetts Independent Pharmacist Association. So I just think it's important to note that there are some underlying issues that are driving pharmacy closures, and there are also some ideas that I have that I think we could help support our residents with. On the underlying issues, it has been touched on, the pharmacy reimbursement issue. Several years ago, Mass Health did move many patients onto ACO and MCO plans. Those plans are run by big companies like BMC and Tufts, and unfortunately, they have really destroyed the pharmacy ecosystem here in Boston. BMC, for example, runs a very large plan that up to a third of our residents get their health services from. And while they seem to do a very good job on the medical side, they significantly underpay our pharmacies on the pharmacy benefit side. Walgreens, the subject of our conversation today, they actually opted out of participating in that plan because the payments were so low, which has then driven a lot of these stores to close, because when you can't service a third of your community based on the contracts that are presented to you, it just makes it very hard to continue to do business. Luckily, a lot of that is changing in January through efforts of our organization and basically re-educating the people at Mass Health as to how bad the situation has gotten. There are some changes coming which should help stabilize us. On the solution side, for finding solutions for our residents, one thing that I have tried to do, as pharmacies close, we see a need for increased delivery services to our residents. A lot of our buildings where we have, whether it's elderly housing or just large residential buildings across the city that do get, whether it's state funding, local funding, maybe tax incentives, I'd love to see a world where we can make it easier for us to deliver to all of those patients by having somebody on site. Usually there's some sort of office manager. If we can create a system where we can deliver medications for residents in those buildings to one centralized office, it would make things significantly easier for our delivery drivers. A lot of times we go out, somebody may not be home, we can't get into the building, we have to make multiple trips, and that makes it harder for us to get people their medications. So I'd love to talk in future meetings or offline with our city councilors as to, a way that we could help to create some programming to help our small pharmacies that do offer these delivery services make it easier for us to deliver our medications to our patients.
Thank you, Mike. Now we'll go to Alan Tanner.
Alrighty. Thank you all for having me today. Good morning, Chair Worrell and members of the Committee on Small Business and Professional Licensure. My name is Alan Tanner. I'm a leader and former organizer with Prophetic Resistance Boston, and I appear before you today to testify in favor of the 90-day pharmacy closure ordinance written by Prophetic Resistance Boston in collaboration with Seniors on the Move and later brought to Councilor Fernandez. That has been referenced to in this hearing multiple times. This ordinance would benefit many members of the community of Nubian Square and Roxbury and beyond. It is well known the disparities that have been proven time and time again for BIPOC and Black communities in particular. These health disparities lead to higher mortality rates in these communities. This means that due to a lack of proper access to healthcare resources, people are dying. This is unacceptable. It's unacceptable not just because of the mere fact that this is a preventable loss of human life, or even to put a larger health risk on communities that are already suffering from health disparities. This is an unacceptable because in more affluent neighborhoods such as Back Bay, there's a longer life expectancy, thereby lowering the mortality rate. This to me indicates better access to healthcare resources for communities that have more money, communities that possess private healthcare insurance, and communities that are predominantly working class people, communities that have cars to get around, so a pharmacy closure would not impact them half as much as Nubian Square and Warren Street residents. I am personally impacted by these closures because my mother, who was recently discharged from a nursing home or rehab facility, would normally receive her medication at the Walgreens location on Washington Street, which is also now a Foot Locker. Keep in mind that only down the street there's a Snipes shoe store. I find that to be unnecessary and detrimental to my mother's health, as I now have her medication delivered or sent to a CVS in Grove Hall, which is a much further distance than both the Washington Street and Warren Street Walgreens locations. And neither I nor my mother own a vehicle. My mother is also in a wheelchair, making it hard for her to ride the bus, as it takes more time and effort to load a wheelchair onto a public bus. These inconveniences do not have to exist, but given that they do, notice of these closures would have been much appreciated so that the transition would be made more smoothly. Should we allow people to die or become chronically ill because of money? Is this the society that we want for our future generations? Where we tell our children that if you don't have money, large corporations that affect your well-being will let you die or become very ill. I, for one, do not want to live in such a society. I believe that if we, at the barest minimum, allow our Boston residents to have the time to transition their life-saving medications to another pharmacy, we are at least trying to hold up our responsibility to the community as activists, as organizers, and as elected officials. In closing, I say let us do the right thing by our community and by our city and pass this 90-day ordinance to give Boston residents a fighting chance against large corporations who are taking away our access to healthcare as BIPOC people. I yield back.
Thank you, Alan. Thank you to all the panelists, everyone who came to testify, the public that came to testify. I want to thank Walgreens for being here, the community that sounded the alarm from the very beginning of this and organizing around this. All my colleagues who helped organize and spoke out from the very first time. Councilor Fernandez-Anderson for sponsoring and bringing this conversation to the council. And also just want to thank Central staff for making this virtual hearing possible. If anyone has, any of my colleagues has any closing comments, you can raise your hand. No? All right. Okay, Councilor Mejia, the floor is yours.
Yeah, thank you, Councilor Morel. And I just want to thank everyone, in particular, Danielle. I see you and I appreciate you, and I think it's really important for us to continue to lead with community front and center. And I also just want to thank Councilor Anderson for the clarification. I had no idea. I had heard there was some business from Brockton, so I'm really happy to hear that it is definitely going to be one of our own that we're going to be supporting. So I'm happy to hear that from you here today. So I'm more encouraged by your clarification. So I'm happy to know that it's going to stay Black and Brown, and I'm happy to know that it's going to stay in Boston. I thought it was from Brockton. So thank you for that.
All right, thank you. Seeing and hearing no other remarks, this hearing on docket number 0183 is adjourned. Thank you.
Thank you, Chairman.